Hello and welcome to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about atopic eczema. Atopic eczema or atopic dermatitis is one of the most common forms of eczema, a condition that causes the skin to become dry, itchy, and cracked. Atopic eczema often occurs in people who get allergies. In other words, atopic means sensitivity to allergens, so a genetic tendency to develop allergic disease or heightened immune response. That's what atopic means. Eczema means patches of skin that become rough and inflamed with blisters that can itch and bleed. It's the most common type of eczema in children, and it often develops before their first birthday, but it may also develop for the first time in adults. It's usually long-term or chronic condition, although it can improve significantly or even clear completely in some children as they get older. So it can be associated with other atopic conditions such as asthma and hay fever, but the important thing is to remember is that this is a certain type of eczema that we're talking about in this video. There are other types of eczema, but in this type of eczema, the causes are actually unknown. It can run in the families, like we said, it's an association with other atopic conditions, and symptoms of atopic eczema often have certain triggers, such as soaps, detergents, stress, and the weather. Sometimes food can play a role here as well. So we know the symptoms of it. Now, how do we actually diagnose it? So we know that the symptoms are dry, itchy, scaly, blistery skin, but is there a way to diagnose it? So it's a waxing and waning itchy condition, but the most important thing to note is that if there is no itching, then it is unlikely to be eczema. But if there is itching, then either 3 or more of the 3 following needs to be there to be diagnosed with eczema. So itching in the skin creases, a history of asthma or hay fever, onset in the first 2 years of life. So here we already have 3. And generally dry skin is another one as well. And also visible flexural eczema. What are flexural parts? So flexural parts are the body parts that are able to flex. So the back of the knees and the insides of the armpits, elbows, and groin. So we know how to diagnose eczema now, but we also have to consider some certain things when we are taking a history. So the onset and distribution of the disease. Is there a family or personal history of atopy or asthma? Are there sleep disturbances due to the itch? Is there an impact on quality of life? What are previous treatments that have been tried? Have there been any aggravating factors? These are all important things to ask when taking a history because we need to personalize our approach. And the other thing to consider is, what is the differential diagnosis here? So is it scabies perhaps? Is it ringworm perhaps? Is it a rare condition perhaps? So these are things that can sometimes blend in. They can mimic eczema. In vast majority of situations, it's going to be eczema, but these are the things to consider. So it's a waxing and waning itch. Itch is very important, and the diagnostic criteria are there. So we need to have 3 or more of the following things to categorize it as eczema, and also very important history taking, or rather what to ask during the history taking. We have highlighted here, so we have a comprehensive approach to eczema. Now let's talk about management. This is where it gets really interesting because there's a lot of components to management that people don't know about. So the first thing regarding management is to educate. So we have to explain what the condition is, provide verbal, written information on a stepped approach, explain the creams and things like that. Avoid irritants, so that's very important. And also to advise loose clothing, so avoiding wool, avoid excessive heat, keep the nails short, and gloves in bed if we need. Before we get to the main things, which are emollients and steroids, let's talk about other management. So antibiotics. So we use antibiotics when there is an infection. We use oral steroids as rescue therapy, only really as a last resort. We use immunosuppressants sometimes on the advice of specialist care. We use antihistamines, in particular if there's nighttime symptoms, a lot of itchiness, which can be prominent. We can manipulate the diet a little bit, right? See if there's triggers there. We can use wet wrappings, and we can use bandages as well. And then we come to the actual mainstay of management of eczema. So emollients and steroids. Emollients, they come in various shapes and sizes: creams, ointments, lotions, gels, foam, etc. Ideally 3 to 4 times a day, but if I'm being very honest with you, the more the better. And then we have topical steroids. So we usually prescribe the least potent strength that is effective. The thing about topical steroids is very important now. So topical steroids are applied either once a day or twice a day, depending on the strength, and we usually have to apply it in coordination with the emollient. So give it 1 hour apart. I don't mind, doctors don't care which order it's given in, but give it 1 hour apart. And also, fingertip units is very important to understand. So 1 fingertip unit should cover 2 palms. So that's how much steroids you should actually be using. So not too much, not too little. Emollients. The management includes regularly applying leave-on emollients and washing with leave-on emollients or soap substitutes. But there's a common misconception here. Bath additives. So bath additives are not something that should be prescribed. They are not effective or cost-effective. So we don't tend to prescribe them. A lot of people use them. A lot of parents use them. A lot of people with eczema use them. But we don't prescribe it. It shouldn't be prescribed. New studies and research has shown this. Instead, what should be offered is a personalized approach and education on how to manage eczema forward. So that's the most incredible and critical fact here regarding eczema. Now let's really zero in on emollient use. So personalized washing advice. That's the important thing we're going to zero in on here. And then we're going to talk about some final tips regarding emollient safety. So if current emollient causes irritation, then we obviously have to offer a different way to apply it or a different or alternative emollient to use. We have to use leave-on emollients or emollient soap substitutes. Again, not bath additives, but we use those instead of soaps and detergent-based wash products. We can, however, leave on emollients, put them in bath water. So we can use them in bath water. We're just not going to use additives. Children under the age of 12 should use leave-on emollients or emollient soap substitutes instead of shampoo. So that's very important to note here. And also, older children using shampoo should use a brand that is under-perfumed and ideally is labeled as suitable for eczema, and they should avoid washing their hair in bath water. So that's personalized washing advice, very important facts there. And then we move on to some final emollient top tips. And these are really, really important. A lot of people don't think about this, but it's really, really important to consider. So emollients, they can be transferred from skin to clothing to bedding, etc., which can then be flammable. So the important thing here is to wash clothing, wash bedding, wash it in high temperature, and even then sometimes it doesn't prevent it all. So it can be flammable, so watch out. Prevent contamination of emollients by using a pump dispenser, for example, or scoop it out with a spoon or a little spatula or something like that. Prevent contamination. And then also consider that emollients are slippery. So we have to use a non-slip bath mat or wash it all. Wash your bath, wash your bathtub, and so on. And there we have it. I hope you learned something about atopic eczema. It's a very tricky thing, needs to be managed. Use a whole load of emollients, I don't mind. And also topical steroids, 1 hour apart, fingertip units, that's the most important thing. I really hope you learned something from it. Atopic eczema, more and more should be a personalized approach towards it. And that's it. Please like and subscribe for more. Leave a comment in the section below, and we'll see you in the next video. Take care.